Welcome to Talking Live. I'm Dr. Robbie Ludwig, and we are doing Talking Live during COVID-19. We're doing a special to deal with all of your medical, mental health issues, and just how to live your best life during this challenging time. I am so thrilled to have Dr. Daria Long. She is a Harvard and Yale emergency room physician. She's also a best-selling author, Mom Hacks. She also, you may have seen her on CNN, HLN, Fox, Dr. Oz, The Doctors. She is a TV expert, and she also has a very popular TED Talk out there called Ending the Crazy Busy. I think it's safe to say, Dr. Daria, that we have done that.
Hi, Robbie. How are you on this crazy day, I guess some could call it, although I don't like to use that phrase, but yes, it is. It's a crazy time.
It is. You know what? It feels surreal. And I live in New York City. I know you're in Atlanta, correct?
Yes, exactly.
Okay. So we are right in the epicenter of just the height of this COVID-19 pandemic. And it's been a little bit strange because New Yorkers are always living that fast-paced life, especially for people who are extroverts like me. I like to be out and about. So now I'm in and about. It's an adjustment.
Yeah, it really is an adjustment for everyone. And yes, you being in New York, you're dealing with it on an exponential scale to the rest of the country.
Yeah. So you have been so comforting. I've seen so many of your interviews, and you must be going through a very busy time right now. What are you noticing in Atlanta?
So we are seeing, and just like everybody listening, all of our responsibilities, all of our worlds, typically we used to have, your personal world and your career and your family, and all of these things were kind of lovely and categorized and discrete. And now they are all smushed together like an atom bomb. So right now I'm filming in my home, my office at home, and my kids are just over there, hopefully going for a nap soon. And then also working as an emergency room doctor as well, when I'm not doing the TV thing and the mommy thing. And we're seeing people medically, we're seeing a lot of really sick people. And I was talking to a friend of mine who's an infectious disease doctor. He said, I treated malaria in Africa. This is worse. So it's a frightening time from a medical perspective as well.
Yeah. Do you worry for your own safety? I know I work with both physicians and nurses who are on the front lines, and they feel very stressed. They also feel an enormous sense of responsibility.
Yeah, this is really true. It's kind of course, everybody feels it differently, but I think throughout all the physicians, throughout all the nurses, there's an enormous amount of pressure, and it's twofold. There is the pressure to take care of your patients. We always feel that. I'm used to that moment of having my hands so full with patients, I can't handle anybody else. And then somebody else comes to the door and you find a way to do that. That's why I trained as an emergency medicine doctor. But there's an extra complexity to this in that we're used to running into the fire, but I'm used to running into the fire with my hose and my axe and my full battle armor, not to then have to worry about, am I going to be exposing myself? Am I going to be exposing my next patient and my family? So that's an additional layer that we didn't expect. I mean, I worked during Ebola. I was at Emory at the time. We took care of Ebola patients. I trained on how to put on that exact crazy hazmat outbreak suit. And so I knew that I could take care of the patients because I wasn't worried about my own health and then spreading it to somebody else. That's not here now. And that's what makes it extra hard.
There are so many questions that people have, and I love how you describe your job. Your particular area of medicine is the MacGyvers of medicine. I just thought that was just a beautiful description. There has been a lot of talk about to wear masks or not to wear masks, and there's a lot of confusion around this issue. When I first heard about it, I was told, listen, you can reinfect yourself with a mask. Now they are recommending it in New York and in California. I think it's statewide or countrywide as well. I'm not sure.
You do, Robbie, this is why you and I are talking today. And this is why I'm sure you do so much of the messaging that you do, because the misinformation, the confusion, it is, it's always a little bit difficult with health, but it's even harder right now for consumers. So when it comes to masks, here's what I'm telling people. Kind of since the beginning, I've been saying you can wear a mask. It's not going to hurt you. You don't have to worry about kind of reinfecting yourself with the mask, unless, I guess, technically if you wore it when you were sick and then you wear it now, but you should have immunity. So put that to side. What I'm telling most people is, if when you go out and you're the general public, yes, put on one of those cloth masks. We know that it helps decrease the spread of infection from you in case you are symptomatic or even asymptomatic but positive. And there's some evidence that it may also reduce your chance of also getting sick. So I'm telling everybody, do it. It does not mean it's licensed to go party. Like, I saw somebody tailgating that day, Robbie. I was going to lose my mind. This is not licensed to tailgate, but when you're doing those essential activities, going to the grocery store, wear a mask, and that's going to help protect you and other people.
I'll tell you, New Yorkers are usually bumping into each other. Not now. I seriously had someone say to me, "Get away from me." And I wasn't even close. I swear to God. I was like, well, that's new.
You're like, okay, I've got 6 feet. I actually, Robbie, to that point, because New Yorkers, you're used to having somebody right next to you. I posted something on my Instagram last night. It's a video, a movie, and it's 30 seconds. It's stunning. It shows two people standing 3 feet apart, and they somehow recorded their breath going back and forth. Oh. I was like, just watching it. It's on my Instagram. I was like, just watching this is enough to make everybody back up a little bit extra when you realize how much it goes back and forth.
So now they're thinking that, and we're still learning about COVID-19. That's what makes it so dangerous in a way and confusing. We don't know a lot about this virus, but the new information is that just from breathing next to somebody, if they are infected, you can get it. Is that true? They don't have to cough?
So, and you're right. There is so much we're learning, Robbie. We just found out about this virus, what was it, 4 months ago? I feel like it was 4 years ago, but it was 4 months ago. I'm aging in dog years right now. There are different ways that the virus can spread. Some are really super infectious and some are possible but low risk. I put breathing in terms of the possible but low risk. And what they're talking about, there was one study that found that people who are coughing, who are sick, that when they exhale, they are exhaling small amounts of the virus. Is it enough to make you sick if you happen to directly inhale it? We don't know, possibly depending. And again, it comes down to the volume. Like, if you're living in the home with that person, you're breathing their air all the time, then yeah, it's probably enough to make you sick. If you pass by them on your walk, is it enough to make you sick? Probably less so. But so that's why I'm telling people, this is not binary, as in like, yes, this will make you sick or not. It's about, will this increase your chances? That's why the mask comes in helpful. It doesn't stop everything, but it creates a little bit of a barrier. It's something people can do.
We were told in New York that it's always best to assume that you are a carrier and to conduct yourself in that way. We've heard a lot of terms lately. One of them is asymptomatic. And there also can be subclinical, symptoms of COVID-19. Can you take us through what that means exactly?
Yes, absolutely. And Robbie, you probably feel the same. These are phrases that I'm sure in your own profession you were familiar with, but I feel like we're teaching the public a lot about them, because I have found that the message can be very confusing, but the best way to help empower people is to say, I'm going to, come with me into the ER a little bit, or let me teach you a little bit about these phrases. So you'll know why we're telling you what we're telling you, and you'll understand when it changes why. So asymptomatic, subclinical, same thing. So asymptomatic means you have the diagnosis, you have the disease, it's in your body, but you have zero symptoms at all. You're going about your day. Subclinical, pretty much the same thing. Maybe you have a little bit of symptoms, but not much. How many people are asymptomatic? Don't know. And in part because, to your first point about you're just telling people they assume they have it, that stems from the fact that we are not able to test people. So we're flying blind. And, for every one patient I test in the ER, there are several that I wish I could test that I think have COVID or something very similar to it. That I can't rule out COVID. And I tell them, I say, just assume you have it. Please act as if you do. Isolate yourself accordingly. And then, and go from there because I can't test you. So that's the first thing. So asymptomatic then means people absolutely no symptoms anywhere. One study from the CDC said that about 12% of transmission is due to asymptomatic people. So, Fauci says, Dr. Anthony Fauci says that he thinks about 50% of people are asymptomatic. We don't know. But again, it shows that if 50% of people are asymptomatic, but only 12% of the transmission is from them, it means that people who are asymptomatic may not be as contagious as somebody who's obviously like coughing like crazy, but they're still contagious, which is why we're telling people, even if you have no symptoms, wear that mask for everybody else.
In New York City, we just found out that we may have hit our peak. It's too soon to tell, but there may be a flattening of the curve, which is good news, that the social distancing and the hygiene practices appear to be working. And I wrote this down because I wanted to make sure that I got it right. The New York State Department of Health just approved an FDA-approved antibody test. Antibody test.
It's all good. The British say antibody. So, you say it however you want, Robbie.
Pretend I'm British. Antibodies. But this seems like it could be a game changer because It seems like we would fly less blind. Can you tell me anything about this test and what it would mean for all of us?
So this would be huge, Robbie, and just for the viewers, there's kind of two different kinds of tests. There's one test that looks for the virus in your body that says you are sick right now from COVID. That's different from this one, which is, and that's like a nasal swab, which I've had some patients say that like it's one of the most unpleasant things. Why I apologize for everybody who's had this swab. The antibody test is a blood test. I'm touching my veins you can't see them. They're out of the camera, but so what they're going to look for is, have you been sick? Has your body mounted antibodies to fight the virus? And now are you immune? So now you would know, because so many people have come to me and said, I was really sick in February. Do you think I had it? All of those. This is why it's so important. One, to kind of give you.
I think I was one of those people. I really do.
I have been.
Before it was even talked about, before they knew anyone had it in the United States, it wasn't even a word that came up. But I had this horrible headache, a cough that lasted a long time. I wasn't feeling myself. Food tasted a little weird. I never want to not eat. I know that's a double negative. I always want to eat. So the fact that I was not eating as much is so unusual for me. And I was like, I wonder if I had it, but this blood test potentially could tell us.
Yes. And as a side note, that is like one of the biggest, that's like the sixth vital sign if people don't want to eat. I can tell somebody has appendicitis or not. When they come in, I'm like, and they have that bad belly pain, I say, do you want to eat? If they want a burger, I'm like, you don't have appendicitis. Now, of course, this is not truly diagnostic, but then they say, like, I don't want to eat, especially if like a teenage 15-year-old, he's like, I don't want to eat anything. It's like, call the surgeon. So not wanting to eat, definitely always a sign of something, especially for coronavirus, because it's that loss of taste. You lost your sense of taste, so everything tastes funny. So the antibody would be really helpful, one, for peace of mind, but it's not that. The reason we want the antibody is because I've been telling everybody, we've been a step behind this virus the whole time, in part just because it was brand new. It was a step ahead of us by coming into being into humans, but we have to be looking, like as an ER doctor, when I take care of a patient, whatever their diagnosis is, I think, how can I stabilize them now? And then what do I need to do next to get them to the next step, whether that's discharge or out of the ER? We need to be applying that same mindset right now. What's our exit strategy? How are we going to start letting people out of their homes?
Yeah.
You may have heard.
I want to know. I am curious because the shelter in place and also the quarantine has been state by state. What impact do you think that will have on us? So there are states that are not sheltering in quite the same way. It's not countrywide. I have a concern about what happens if there's reinfection. I certainly don't want to do this again. I'd like to do it once and then move on.
Mm-hmm. So there's a couple different things. That was a really good question, and I want to unpack that in a couple different ways. So the shelter in place, when it goes state by state, part of the problem is you get very mixed messages to our nation. Now, I understand in some ways because some states, New York, Louisiana, Washington, seem to be so far ahead of the rest of the curve. So maybe there should be some difference in timing for some states. But then what happens when you have some states who are shelter in place and others are not? People don't know what to do. You get people from one state coming to another. I've had several people I know who moved from one state to another, to state another, then developed COVID or maybe brought it with them. You create this very messy scenario where it's also impossible to track contacts and trace that and to limit the virus. So I think it's been very challenging because we haven't had a centralized, here's the guidance of shelter in place, here's how we should do it. That's absolutely goes without saying that's a problem. How we get out. Go ahead.
No, I was just going to say, I feel like the little kid in the back of the car with her parents in the front driving saying, are we there yet? Are we there yet?
Robbie, you and the rest of our nation. So that's why we have to talk about an exit strategy, because just what we're doing, this social isolation, when we get out, social isolation itself is a key tool, but it's not the only one. So we cannot expect that we just socially isolate and then in 4 weeks or 6 weeks, we all just run out like kindergartners onto the playground like crazy. Then because if that happens, there will be another peak in the virus. So people need to know that we have to be very smart about it. Antibody testing will be kind of one of the first ways to do that. Because then you can say, okay, you've had the virus, you're immune. We don't know how long, but you're at least immune for the next few months. You can go out. Or then we'll say maybe the next group of people who aren't immune, but they're kind of lower risk when it comes to COVID. Maybe they will catch it, but they're lower risk. And we do some teaching around that. We're going to have to be very stratified because we cannot keep the country on lockdown forever. And with really the best thing is to wait until the vaccine comes out. That's a year away. So how can we be very intelligent so we don't waste everything that we've all just done and we don't backtrack? How can we go forward intelligently and strategically?
What do you think post-pandemic will look like, or post-quarantine, I should say? Yeah. What will that look like? Well, I was just going to say, is it still social distancing? Are we going to be able to go to restaurants? Can I see my hairdresser again?
Oh, Robbie, now if you're talking about important things like our hairdressers, we're doing our own haircuts at home.
You need humor.
I know. Don't cut me down like that and say I can't get a hairdresser. But I think that in all seriousness, I think we're going to come back in kind of like a staggered way. We'll go back to what's deemed essential. Clearly, somebody I'll fight it out for if that hairdresser is essential or not. But what's essential, go there first. I think that'll be kind of phase one. And I think, just like anything, we're going to see the shadow of this quarantine kind of follow all of us around. I think in some ways that's good. In some ways, people may be a little bit better about hand hygiene. I never, as it is, I don't touch an elevator door button because I know the bugs that are on it from working in the ER. So maybe there'll be a little better hand hygiene, but I think we'll have to be very smart, but I think there'll be a little bit more of a distance between people and living in a new normal.
Just to segue into mental health, there are a lot of, or certain similarities between having a panic attack and some of the COVID-19 symptoms. Can you differentiate between the two or help us to do that?
Yeah, absolutely. And this is, I'm sure, exactly also very much in your wheelhouse. So, chime in here. COVID, the trouble is many people with COVID who get very sick from it, when we see the complications, it's respiratory failure, meaning they cannot actually breathe. So the symptoms of that, you'll be breathing quickly, breathing shallow, just feeling like you can't get air. And it is that feeling of, you just walked up 20 flights of stairs and it doesn't stop. It doesn't go away. You didn't walk up those stairs. It just stays there. So that is, now someone who has a panic attack, they may feel that way. They may feel their heart is racing. A panic attack, though, tends to, and Robbie, chime in because you're the expert here. That tends to go away in a way that that COVID isn't going to just necessarily, if I tell you sit down and go away and relax, somebody who's having a severe COVID condition, relaxing isn't going to help them. They'll be leaning forward. Their air hunger, I think, is how we refer to it. And that is different from panic attack, quick breathing.
Yeah, that's such a great way to describe it. Air hunger is really beautiful. And I think it really hits home. You talk a lot. You're the mother of 2 young children. How old are your kids?
They are 3 and 6. So we are so in it right now.
And I have 2 teens. So I did it a different way. Yeah, they're home around me. They're like, you're loud. You're very loud. I'm like, I'm working.
You're like, somebody has to pay the bills around here, people.
Right. It's like, so there are challenges really in different ways because the teens really feel like the intensity of the loss. And, I think with mothers of young children, it's hard to get anything done. It's hard to work and negotiate. What do you recommend to those young moms out there who are struggling?
Yeah, and I think you're right. In some ways, Robbie, I think my job is easier than yours because your teens realize what they're missing, and they're missing, school and sports and graduation things. As a 6-year-old, my 3-year-old, I mean, we were thinking his life is spring break as it is. So he doesn't feel like he's missing anything. My 6-year-old is a little bit, but it's not the same. It's missing her friends. So I think, and also I think it's physically demanding. I'm surprised. We're fortunate that neither of them has run in on me right now during this interview. I know I'm going to be that mom on CNN. I'll be doing a segment at some point, and then like my 3-year-old comes waltzing in like that dad in the BBC. It's going to happen. But what I'm telling a lot of moms of young kids, it can be hard to find that time. So I'm saying we have to have our routines. Every day cannot be, if you don't plan out the day, then every day is just fly by the seat of our pants and we're not getting any work done. You're not having any time for yourself or just to get like the laundry done. So having the routine, and sometimes if you have, a 2-partner household, if you're both trying to work, say, I'm going to work from 6 till noon. And you take the kids, and then I'm going to take over from 12 to 6. Different things like that can help when you have young children, and also kind of creating little lists of activities. Like there are times when nobody's going to watch your kids and you've got to get something done, and giving yourself grace for some screen time right now, but finding some activities that your kids will do. My daughter did this thing yesterday where an astronaut read a story to her on YouTube. It was so cool. Both of my kids. So finding those things, there's some really amazing pieces of content out there that if you need to plop your children in front of something and feel like they're learning something because you just need some time away for a minute, whether it's to do work or just to regain some sanity, that's okay right now.
I agree. It's don't aim for perfect. It doesn't exist. Things may be messy, but give yourself a break. And I just recommend, and I love this, give yourself a compliment every day. Because
I like that.
Yeah.
Yes.
Together. I am so thrilled to have you and meet you, and you'll have to come back. We'll have to do this again.
I would love to, when we can talk about something totally unrelated to COVID.
I gave you another book that you're not working on yet.
Yeah, you told me. Yes, for the viewers, Robbie asked me about my next book. I was like, stop. I just finished one.
I know. Take your time. You don't have to rush. Don't rush on my behalf. What's your next? What can we see you on next? Are you working on anything important right now or fun?
So I'm doing a lot with CNN, NBC, a lot of different networks, but what I'm trying to do, what I found most valuable during this time is on Instagram. So I'm at Dr. Daria because I realized there were so much misinformation, so many questions. People wanted to feel like they had somebody who was answering those questions. So I have people put in my comments or put in my stories, ask me your questions. And then I go on every day and answer a couple in my stories or in different ways, or I do a post about it. So Instagram is the best way to engage with me right now. And the way I can keep people most up to date as the news changes.
Fantastic. We will post that. Stay well, be well.
Thank you.
And I look forward to chatting with you soon. Thank you so much for joining us.
Bye, Robbie. Have a great day. Thank you.